Good afternoon, everybody. I hope everybody can see and hear me just fine. We are here for the Innovation in Life Sciences track at HXD 2021. I'm Tiffany Mura, the Vice President of the Life Science, Client Experience and Strategy for the Health vertical here at MadPow, and I'm going to be your moderator for this today. And I'm going to start sharing a small presentation. We're going to talk to you for a couple of minutes here and then turn it over to Amy. For our panel today, we're joined by three really phenomenally talented women in the life sciences industry. We've got Amy West, the Head of Digital Transformation and Innovation at Novo Nordisk. We've got Jessica Mays, the Senior Director of Life Sciences at 2020 Onsite, and Beth Liskorsky, who is the Digital Lead for Patient Services Marketing at Takeda. But before we get started, I wanted to get into a little discussion on how change happens. This concept comes from our Futures Thinking group here at MadPow, and I think it's a really interesting framework as we think about what we're going to talk about today. In the discipline of futures thinking, which is studying and planning for possible futures, futures being plural because there are many possible futures, there's an element called discontinuous change. And the idea is that tomorrow's not going to be like today, and it likely won't be a gradual linear progress that gets us there. Rather, it'll be punctuated equilibrium, whereby we're in a steady state of gradual change that's punctuated by periods of great discontinuity that cause rapid change, and then we emerge out of it in a new normal equilibrium. And I know we're probably all tired of hearing that new normal phrase. However, it really is how it works, because we're not going to go back to what we were doing before exactly the way we were doing it before. We aren't going to stay in this period of discontinuity. And what we go forward into is going to look very different than what was before this. We are in this period of great discontinuity right now. And as it applies to life sciences, there has not been a period since World War II with such transformative effects across the industry, from the practice of medicine to the use of technology to the warp speed discovery, development, and approval of not one, but 3 vaccines within a year utilizing novel mRNA technology. During this time, life sciences companies have been stretched, challenged, and forced under extreme circumstances to adapt and change. While the silver lining pales in comparison to all of the lives lost, it also provides enormous opportunity. The question is how will we embrace the positive aspects of this transformation to fix that which has been so broken in this industry? And how will we ensure that the innovations are inclusive and equitable? I hope you keep these themes in mind as we go through the 3 presentations. And we're going to start with Amy West, who's going to be talking about a human-centered approach, now more important than ever. And then we're going to move on to Jessica Mays, who's going to talk about driving change in a mobile vision clinic. And then Beth is going to wrap us up with a patient services team response to the needs of its patient community. Then we'll move into a 30-minute Q&A period that I will moderate. So I'd ask you to put your questions in the chat. We're only going to be taking questions through the chat, not through video, and I will ask them during that time. So with that, I will turn it over to Amy.
Hi, everyone. Tiffany, thank you so much for the setup, and share my screen and would just ask, I'm assuming that it's coming through. Tiffany, let me know if it is not.
Oh, there you go. You're set now.
So Tiffany, thanks again. You know, my name's Amy West, and I've been in the pharma industry for over 25 years, primarily in the commercial space across many categories, with a heavy focus on customer engagement and experience. I'm currently leading the Novo Nordisk U.S. Digital Transformation and Innovation team, where we're focused on the longer-term future horizon of healthcare and how we can transform how people experience healthcare through disruptive innovation. Our approach is to start with the customer's problem to solve. We try to put ourselves in their shoes and understand their problems and pain points, and then leverage an agile experimentation process to identify novel opportunities and solutions that will deliver that shared value for their needs as well as the business into the future. And I'd like to add too that I'm personally very passionate about the patient side as I am one, along with many of family and friends, I strongly believe that getting access to the pharmacotherapies and traditional health interventions, it's critical, but medication alone isn't enough. And sometimes it can be hard to get timely coordinated care. And we've seen that all too front and center recently with this pandemic, which is why I am really excited to be, working in this innovation, this digital and technology space, because this innovation can enable the ability to go beyond the proverbial pill and deliver experiences that positively influence patient understanding, behavior, engagement, and health decision-making in a personalized and relevant way. And this digital innovation gives us the opportunity to better understand patients as people first and use technology to enable more individualized and relevant solutions or support, along with medication, to achieve better quality of life and overall improved outcomes. So I'm very excited to be here. And to kick off this conversation that really follows up, what I shared, I want to start with a quote from Albert Einstein. He said, "If you always do what you always did, you will always get what you always got." But in the world of life sciences, you could argue that if you keep doing what you've always done, you're actually going to get less than you had before. And I think that's very true in what we're seeing in healthcare right now, is that the way that we've been, conducting our services and our product delivery and our interventions have worked for a really long time, but we're starting to see a lot of problems. We haven't seen a lot of problems with adherence rates and outcomes and, issues with quality of life. And while the pharmacotherapies and the interventions and the surgeries have gotten better and better, the outcomes are not improving commensurately. So what do we need to do, in light of this? What do we, why do we need to change? And I think we could say that even before COVID, over a year ago, poor patient experience and rising financial burden necessitated patients to be more engaged. And, patients are very vulnerable, and they're being asked to place more and more of their out-of-pocket dollars toward the healthcare spend. And by virtue of this, we would expect them to demand or expect, an increased engagement as they continue to navigate the system and make choices based on personal preference, convenience, and desired experiences. And, now that they're having to pay more out of pocket, they're really not having an improved experience. There's a lot of things that are inefficient. We've seen a lot of that even exacerbated by COVID. There's a lot of communication breakdown between the doctor and the patient. We've seen that time and time again. Health literacy issues. And despite all the advancements that we've seen in healthcare, the outcomes and the improvements and on the personal level are not in parallel with that. So this is where you're starting to see a much more focused demand on the experience of healthcare in general. If I'm going to be paying more money for this engagement, I have a higher expectations for what I should be getting out of it. And this is why we are seeing the rise of the non-traditional sort of technology players enter the space. Companies like Amazon and Apple and Google, they understand customer expectations and actions and have the data along with the insight to develop innovative solutions that deliver the desired experience and address the individual's unmet need, something that the traditional healthcare players have failed to do. So we are seeing this rise of consumerism based on the burden on the patient, as well as how we're seeing non-traditional players enter the space. And healthcare, the traditional players have to keep up with this. Consumerism is driving change of this legacy healthcare model, which really was never patient-friendly or conducive to delivering optimized outcomes for the majority of individuals. In the past, or in some ways it's where we still are to a degree, it consisted of episodic and reactive engagement controlled by the healthcare setting and decision makers based on a formula. A lot of it was pharmacotherapy specific. But this rise in consumerism in healthcare is creating demand for the delivery of easy, convenient, and pleasant experiences that address individuals as people, proactive on-demand access, shifting the locus of control from the system to the consumer or the customer. And this has only been exacerbated by COVID, and I think we all probably have some experiences with this. So as we're seeing this, how do we ensure that we're going to meet and exceed the new customer expectations as it relates to healthcare? So for starters, I would argue that we need to banish this concept of patience. You and I, along with people living with chronic health challenges, don't identify as patients. We're moms and dads and teachers and firemen, and we're working to balance our life with raising families and work-life balance. It's tax season. We're all focused on getting through that and just living our day-to-day lives. Healthcare is important, but it's inconvenient and it's not a great experience for the most part. And I think we can all agree that when you talk about healthcare and being a part of the system, there's a lot of groaning and a lot of eye rolling going on because it's just not a pleasant experience. So I would argue that to improve healthcare, we really need to marry the science, which is the foundation of what we're doing, with the human being, their everyday behavior, and be where they are, meet them where they are. We also need to throw away the assumption that we're engaging with a homogenous group, a single population with the same thoughts, feelings, and experiences. We're all individuals. We expect and demand personalized experiences with our healthcare team, just as we do with anything else we engage with. And there was a survey by Deloitte that revealed that personalization is to be the highest priority for healthcare consumers. So we really want that individualized experience, and we want to be understood as human beings, not as patients. And for all the the things I've just talked about as far as the trends that we're seeing and the impact of COVID, this trend is not going to go away. It's only going to continue to build, and we need to be responsive to it. So if we start by banishing the concept of patient, then we truly also need to understand the person. What does that mean? And how do we do that? So I would argue that we need to really start with addressing the broader consumer health influencers that sit outside the clinical setting. This graphic that you see here on the screen, it's from the Institute for Clinical Systems Improvement, and it represents the average person managing chronic health challenges. The data shows that only 20% of what influences the health of a person is related to access and quality. And this is where the traditional healthcare and life sciences organizations have focused. And it shows that for the average person managing chronic health conditions, only 20% of what influences the health of them is related to access and quality, meaning getting to the clinic and getting medication. That other 80% of influence, those influencers are found in behaviors, socioeconomics, and motivations. Basically, the aspects of living day-to-day life, which can be very challenging to address in a clinical setting. In healthcare, we're really only focused on that 20%. And it's critical that we shift and start to really better understand that 80% area, that area of who you are as an individual, as a human being, and how you live your life. And this is where we need innovation that will transform the current healthcare paradigm. We need to embrace the rising consumerism of healthcare, which is all about that human experience. And again, very much embedded in that 80% area that you see here. And deliver in ways that will be more conducive to improved management with both traditional clinical engagement and medicines, as well as non-pharmacotherapeutic interventions that are now becoming a huge focus. And this is where tech and digital will play a big role. by working with these innovative resources that go beyond clinical walls or medications or prescriptions, it will be a key to treating complex health problems and can help enable more effective management. So, for example, this idea of pervasive or portable health, embedding support for the individual through technology where the person is via this ecosystem of connected, location-independent healthcare services and solutions that would be accessible wherever and however the user decides. These can really help ease the burden on the individual and improve self-management and medication adherence and engagement. And it also can be very personalized. This type of innovation of technology can also be a combination of active and ambient connectivity that aids, again, in the convenience and the overall individualized, improved experience. So, to really kind of pull this through, if we have this understanding, how do we make it happen? I wanted to share another quote. This is from Peter Diamandis. It says, he stated, become enamored of the problem, not the solution. And Peter Diamandis is from XPRIZE and Singularity University. I'm not sure if you're familiar with this organization, but it's an organization that's very focused on the future world problems, healthcare equity being one of the major ones. And I attended a Singularity University Global Summit a few years ago, and this statement really resonated with me because in pharma, we really are hyper focused on getting our products into the hands of our customers to deliver a health benefit that we've validated in clinical trials and secured via FDA approval. We are very focused on, ensuring that our products are safe and that we hit our numbers, we deliver a share of voice and other metrics that are all focused on our products, but not necessarily our customers' problems. Our traditional approach in pharma is to be very solutions focused, and it can be limited in its success because, and we're kind of seeing that now, if we're not hitting the customer's problem to solve, because we're continuing to see the rising healthcare costs and suboptimal adherence rates. And the need to substantiate the value in a real world setting won't be met with these traditional pharma approaches. So again, when I think about what he says, become enamored of the customer's problem, we will have a better way to deliver an outcome that's going to meet the needs of our customers as well as the needs of the healthcare system. But we need to not simply know our customers as people, but we need to become obsessed with them. We need to continually come back to their problems, start with their problems, come back to them, and really look at them from different angles and truly almost enjoy thinking about them so that becomes our source of solutioning. And I would argue that we will find better and innovative ways to meet their needs if we really put the customer first. And I think it's also important to kind of note here when he says, shares the word, become enamored, because to do that, it requires a lot. It requires, we need an idea, we need a certain attitude, but becoming also requires new action, new mindsets, new energy, and new skills, and new business models. And that's going to be a big challenge for the pharma industry because we're slow to change. But we do need to change our ideas, our attitudes and skills and behavior. And as leaders, we've got to take the lead and motivate and activate our colleagues to become more enamored of the problems of our customers, of the individual, so that we can find the right solutions. And we need to be responsible to take those actions. And so how do we actually take that action? How do we not only talk the talk, but walk the walk? And what I would recommend is an approach that we've taken at Novo Nordisk, which is really attack the problem from a human-centered design approach, really leveraging some of the principles of design thinking to really break down what are the problems to solve for our customers, What are their pain points? So that as we are approaching interventions and solutions for them, we are delivering something that truly has value to them, and we're not coming out with a solution that's looking for a problem. So by taking this human-centered design approach, it enables you to pressure test what is the true desirability, what is the unmet need of the customer. Is there a solution out there that can actually be built? Is it truly something that is feasible to build and develop? And is it something that you can do as a part of your own organization, or is it something that you need to be partnering on? This idea of partnership and co-creation and collaboration outside of the traditional pharma walls is becoming more and more important as we look at some of the tech and health life sciences organizations that are partnering these days. How do you create that feasibility? And then how do you deliver on the viability? What is the shared value? How do you come up with a solution that's going to meet the needs of the customer, but also be something that is viable to actually bring into the market and deliver for the solution for the customer and the business? And so this is where I would just again argue that in healthcare we have to change our thinking and our approach to the problems to solve. We have to truly put the patient, their needs, their problems, and their challenges first, and solution from there. And using these tools like design thinking resources to start to get at the source and build the solution will be a great way to start to really be able to not only talk the talk, but walk the walk and deliver innovative solutions. So thank you.